control, then the rest of them actually quite similar.
How to do muscle tone?
How to do the muscle tone? You ready?
Yes.
Yeah. Okay, we can start now.
Okay. Hello, my name is Kendrew. Today I'm going to examine your upper sensory and muscle.
Okay.
So first, can you?
Yeah, sure.
The skin color is normal. No muscle wasting. No scars, and the muscle looks symmetric. Okay, can you do this one, please? Yeah, do the first. Another one. Yeah, thank you. The rapid test is normal. Can you touch your nose and touch my hand?
Sorry,
touch your nose and touch my hand. Fingers. Okay, so the coordination is normal. Okay, can you hold the pen like this, please? Yeah. Please. So first, just against my. Okay, so the. Yeah. Okay, so muscle power is fine. Thank you. Can you give me deny my power? Okay, thank you. Okay, and okay. So the pressure is normal. Wrist. Okay. Yes. Wrist flexion, extension is normal. Reverse. So finger extension and finger flexion is normal. Okay. And no restrict, no. And the muscle tone is fine. Okay, and. Yeah. Oh. Thank you. Yeah. Yes. Relax, please. Can you count 1 to 10?
1, 2, 3, 4, 5, 6, 7, 8.
Find the
1, 2, 3, 4, 5, 6.
So the muscle reflex is normal, but I cannot find on his tricep side. Okay. Later I will test your sensory. So when you feel it, just tell me. Okay, you can feel it.
Yep. Feel it. Yes. 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 Yes.
Okay, thank you.
Yes. 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 Yes.
Okay, thank you. And now I'm going to do the down and sharp test, and this is down,
Mhm.
and this is sharp.
Mhm.
Okay, please close your eye, please.
Down. Down. Sharp. Down. Sharp. Down. Down. Sharp. Down. Sharp. Sharp. Down.
Okay, thank you. Okay. Vibration. So later, if you feel, tell me when you feel it and when it stops. Okay?
Okay.
Please close your eye, please.
Yeah, I can feel it. Stopped. Yeah, I feel it. Stopped.
Okay, thank you. And tell me, can you feel it cold and hot?
Yeah, it feels cold. Okay. That feels cold.
Okay, thank you. Later, tell me when you feel this is middle, this is up, and this is down.
Okay.
Okay, please continue, please.
Down. Up. Middle. Up. Down. Middle. Down. Middle.
Yeah.
Up.
Thank you. Okay, so that's all right.
Good. Time?
3 minutes left.
Got 3 minutes left.
I
So like what I say, you never run out of time for these upper low limbs. And he did almost everything, but you need to pay more attention about the details. Quite a lot, gaps and mistakes here and there. Shall we go together? Yeah. So for the start, he watched his hands, introduce himself, get permission from the patient, position the patient. That was fine. Then, if you want, you can sit down. You don't have to standing up. Do you want to sit down?
Oh, yeah.
Okay. So first, he did some inspections. He mentioned looking for what?
Muscle waist.
Muscle wasting.
Articulation he didn't do.
He didn't mention for circulation.
Tormals.
He did.
Any rash?
He did mention the skins. He did mention for scars. Now, be careful. What I noticed, as soon as he get there, he only look one arms. Just first couple of seconds, he already say there's no muscle wasting. Then he carry on, then say look left side, and then start talking about there's no skin scars or something. Now you need to look both sides carefully, front and back, all around before you make comments. Now go straight there. Within first seconds, you already mentioned this. So all this is in your head. It's not really you actually looked, make a comment on it. Okay, be careful about this. So that's inspection. Make sure you mention for circulation. That's very important in here. What he did next one, muscle power. Yeah. So he did the muscle power on the shoulder ones.
The coordination first.
Oh, yeah, sorry, coordination. Was he correct? Coordination.
Only one side, no?
One hand, checked just one hand.
What he
Demonstration.
he did both sides on this.
It's the finger to nose that it didn't do.
Okay. How about the rapid hand movement? Was that correct?
No.
What's wrong? So demonstration now, you really need to improve your instructions and the demonstration. You vaguely, everything vaguely say something. Luckily, he understands some of them. If patients never done this before, they won't understand what you ask them doing. For example, rapid hand movement, your demonstration was not clear, so he didn't do it correctly. So somebody pick up. Instead of like this, what you did?
Ah.
Oh, that's what he did. Yeah, that's what he did. I remember. Yeah, that's what he did. So you have to be really careful to do the demonstration and make sure the patient's doing exactly what you want. It's not something vaguely like this, okay? So I remember once one of my students asked patient do that. So that's another alternative way. I never heard of us, you can do this way. So make sure it's a rapid hand movement, both sides. I'm so glad you didn't do it. Hopefully they can demonstrate to others. When you show the patient, you saw that patient understand. You need to check, make sure they're doing this. Okay. Luckily, he remembers patient did both sides, but fingernails only did one side and didn't do it in a high quality. What I mean is, you need make sure you hold your finger there, nose fingers, couple of times, then start move around. So you do in such a rush, patient actually hasn't really, get what you're supposed to do, then you're already finished. You need to make sure patients can do that, then start to move. Make sure you hold one position, patient touch you. This poor model try to find your fingers because you're constantly moving. Okay, you need to hold one position, touch. Then you hold another position, then touch. When patient try to get to your finger, you don't move. Otherwise, then we can trace you. Yeah, it's so difficult. So that's also he forgot both sides. The muscle power. Muscle power. Now I try to think which is, he did two of them correct, another two I'm not sure. One is abduction, because patients two hands already touched together, you hardly can actually do anything, okay? So you need to make sure patients separate, then when you push in, then, was it? Yeah. Maybe my uncle. Was it? Okay.
Separate.
Yeah, so make sure they got room to move. And also you did one direction, I cannot remember which one. Instead of make sure patients doing one joint, your hands was there to push or pull away. One of them. Last one. ADD option. Yeah, last one. So when you did it, so make sure you do it. I know you did everything, but every step you need to make sure it's a high quality one, not just vaguely done this one. Elbows, we need not just elbows, wrist and the fingers. What he did wrong? Oh, he did perfect. You're going to do the same one as well.
Yeah. We couldn't see.
You couldn't see.
Yeah.
But even so, you should be able to pick up. He didn't compare side by side. Flexion should be flexion, extension, extension, flexion, flexion, extension, extension. He did flexion, extension one side, flexion, extension another side. Okay, make sure you compare the same group of the muscles. We say muscle power down. Flexion is a group of muscle contraction. Compare the same group, flexion, the extension, extension. And also starting point, I say you need to make sure patients flex a little bit. Some of the point, patient was quite anatomic position. So also instruction as well. You did so fast, I don't know whether patients really understand what you want him to do. So you need clear instructions. What sort of position you're going to start, what you want the patients to do, or what you want the patients to hold, whatever. So you just quickly.
So both for wrist and for fingers to be flexed?
Yes, slightly flexed. For example here, slightly flexed, easy, then you do flexion extension or even hold the positions. If I totally flat like this, So you cannot really do extension, is it? So if it's anatomic position like this, you can do flexion here. Extension is very difficult, yeah? So you need starting point, no matter which joint here. Finger, you should starting point a little bit flexion, then can do further flexion extension. Elbow, starting point flexion a little bit, then can flexion extension. If anatomic position like this, how you can do extension on the elbow? There's no more room to extend, yeah? So you starting point flex a little bit, then flexion extension, side by side. And the muscle tone. I'm glad you got such a young model. It's just imagine an elderly man sitting there. You was moving so dramatically. We're really hurting them. Okay, so when you do this, actually, we should ask patients whether they have got any joint problems. Because passive now, because we haven't done any musculoskeletal, if you're going to do any passive movement on your patients, first you need to ask them whether they have any problems. Ideally, you should ask them to do active movement first to see what sort of range of the movement. For example, this one, before you do the muscle tone, if you go straight, especially, you will so strong, move like this. If somebody got arthritis or joint problems, you can be really hurting them. So ideally, and before any passive movement, you should ask patients to do active movement to show, say, oh, can you do it? And he didn't give any instruction at all during the muscle tone. Muscle tone, you should say to the patients, you should not do anything. I will try to, move you gently. Gently, please, add these words now. So he didn't give any instructions, just hold the patient's arms, then start moving. Yeah? So be careful, instructions, carefully consider patient's, conditions. If patient have arthritis or have any limited movement at any of the joints, the moment we do we do the nervous system assessment, so that's why we didn't consider musculoskeletal joint problems. But in future, when you practice on your own, you have to consider all around. It's not just 10 minutes for the nervous system. So you should ideally, ask patients whether they have any limited movement, any, joint pain, muscle pains before you actually passive move it, and gently move rather than really, aggressive movement.
And you need to check every joint, not only shoulder.
Exactly, because he was doing like this. I consider more than one joint, but majority is the shoulder. There, you actually need to make sure all other joints is moving gently, please. Muscle tone, muscle power, reflexes. Now, shall we do one by one? Biceps, what he done wrong? Oh, he did perfectly.
I forgot.
Just
Should I
one
do
hand.
The
both
other.
side or
Both.
Yeah, you do.
You need to do both sides, side by side. Luckily, your patient's got such good reflexes. The position, first, again, instruction position, you didn't give patient any instructions. And the patient's position was not that relaxed. You was holding like this when you do a biceps, holding patient. So patient is not totally relaxed. Ideally, patient's arm should rest in somewhere. You was holding like this.
I put him on.
You put a pillow, but his arms is not on the pillow. I know you put. So instruction is important. The patient's position also is important. So you was holding up. Luckily, you got it straight away. That's biceps. Then you need side by side, compare opposite side. Triceps, he didn't get it, did he? I couldn't see. Okay. So
The other thing is good to count, because you don't need to think when you're counting. You ask him to count, but I don't think when I'm counting. I can count
Yeah,
when
it's a
sleeping.
distraction.
Yeah,
say,
you need
okay.
something that you need the
You
attention.
really full attention, yeah. So actually clenched teeth or do a mental math, 345 plus 133. You have to think.
I start doing it myself.
Then you need to think about it. Okay, so that's, triceps also need side by side. Then he tried to do the supinator again. The patient was holding for him, So patient should totally relax. You need to tell patients to relax, don't do anything, Let me help you.
To do the tricep, is it best to go round the back? Because it's very hard. I find it a hard one.
You find an easier way for yourself to do. So I prefer standing on the back, easy to hold the patient, Maybe another reason because I always do a demo. So if I standing on the back, everyone can see. If I standing in front, I will block your view. Maybe that's why I standing on the back. So it doesn't matter if you want to stand in front, that's fine, Just make sure patients understand what they're supposed to do. That's reflexes. Now, if reflexes you only done half without another half, you fail this station. Okay. I will keep saying this. You have to be side by side. If you forgot side by side, you will fail the station. Step 3. Again, side by side. Instructions, you need to make it more clear. Not say light touch. Now, what instructions he gave you, you cannot remember. Was not detailed enough. So that's the thing.
Yeah, I can't really remember what
Was
you
that
said actually.
Felix?
You just said, yeah.
Just tell me when you feel
Yeah.
feel it. Oh, yeah.
Okay. So you need, all the instructions need to make it much clear. So I say I will use this cotton wool, touch your upper limbs. And that's the feeling you will have on your upper limbs. And could you close your eyes, please? Yeah. Now, we say when you do it, you need to do an anatomic position. So patients are almost like this. So when you touch, you think you touch, for example, he didn't call the dermatome out at all. So you say, when you touch, you think, for example, here, if anatomic position here is what? Anybody remember?
6.
6. So the model at that moment was like that. So he was touched here. If you look, your diagram, this is not 6 anymore. So make sure in the anatomic position, so you make sure that's touched 6. Otherwise, models are almost like that, you all turn all the way around. So starting on the anatomic position, call the dermatome out, please, side by side. Okay. And he repeat this sort of mistake, one side, another side, and then he did it again when he did the pen, dull and the sharp ones. So make sure side by side, remember? I'm so glad he actually put himself forward, he won't forget. So when the rare exams, you will remember, yeah? If you repeat the same, I threw you out of the window. Should remember from now on. Okay. So that's light touch, pen pen sensations. Temperature-wise was okay. Again, vibration sensation was not clear enough. You should say, put that one. So can you feel the vibration? Say, I'm going to do this on your, fingers, whatever. Please tell me when the vibration, can you feel when this vibration starts and when the vibration stops? So because the model is half helping, so just guessed what he wanted and told him the result. That's it. Proprioception, unfortunately, in my position, I couldn't see clearly. Was he stabilized the second joint?
Yes.
And hold on each side of the finger? Good. Okay, that's it. So it's not very difficult, but you have to pay attention in details. Have to say, we only finished learning this last week. So good memory, you remember everything, everything put together. You just need to pay attention about the details, how to instruct the patients, how to do it exactly what we want, rather than do it vaguely. Yeah. Any questions so far?
Yeah, I have a question about the muscle wasting. How are we checking that? We are not just looking.
Just looking.
Just
Muscle
looking.
wasting is inspection, just looking. You make sure you look in front, the back, each side, compare side by side, make sure. If there's muscle wasting, normally, you can see straight away. Just looking, yeah. Anything else? Good. Practice then. So hopefully you all can take your trousers off. Please don't record this. Then you will cut just that sentence. Our lecturer told us to cut it off. So yeah.
Lily on YouTube.
Yeah.
Message for all male students.
With the minimum is 10, yeah.
So yeah. Make sure you do it.